Welcome to Mint. I am Anuja, and in this episode of From the Newsroom, we have with us Vidya Krishnan. Welcome, Vidya.
Thank you.
Joining us on the phone line is Dr. Amit Sengupta, public health activist from the SwasthyaAbhiyan. Welcome to the show, sir.
Thank you.
So today we are here to discuss how the Indian government will soon table the 12th five-year plan. The plan has a detail about how India will roll out the universal health coverage in the next 5 years. My first question is to you, Vidya. Tell us about the issues that involve the UHC in India.
The basic elements of universal health coverage is the government intends to improve access to healthcare, provide affordable medicines, and bring in some sort of a regulation in the largely unregulated private healthcare sector. According to a latest report, nearly 60 million Indians were pushed below the poverty line last year because they could not afford medical care. The simple idea here is that the government is going to reduce the common man's out-of-pocket expenditure on purchasing drugs by distributing free drugs from government hospitals. In addition to that, the government will provide a basic safety net of services, which will be called the Essential Health Package, which will cover an array of services for which the citizen will not have to pay. Between these two are the first steps towards a much larger vision of universal health coverage, which will be rolled out in the 12th five-year plan.
Mm-hmm. Dr. Sengupta, my next question is to you. You know, this whole thing about UHC brings the debate back on health insurance versus health assurance. So in the case where UHC gets rolled out, what happens to government insurance schemes like RSBY?
No, from what we understand, the proposal is that existing schemes, including the RSBI and other state schemes, will be over a period of time integrated in the universal healthcare model that is being suggested by the Planning Commission. Now, what we do not know is how this integration is going to take place, and more importantly, how many of the concerns that have now been raised about these insurance schemes, which have been in the press in the last few months, are going to be taken care of. Specifically, for example, the different ploys that private care providers are using to milk the scheme, as well as the problem that this is entirely a scheme for tertiary health care, which means that resources are being drawn in to tertiary health care at the cost of primary and secondary care. So it is not clear how this is going to happen, but what we understand is that the proposal is to integrate it in the larger UHC model.
So picking up from there, Vidya, tell us, how do you see this whole thing going forward, the whole idea of health reform going forward in the country?
The immediate next step is that on the 15th of September, the Planning Commission will meet, where they will iron out various details like the role of insurance, private sector, schemes like RSBY, whether they will be absorbed by UHC. Once that is done, now this is not something that can be done in the next 5 years. The government will be doing it in the next 20 or 30 years. And health in India is a state subject. So regardless of what the policy or the guidelines they give out, state governments have to be willing to play ball. So over the next 5 years, the government will set out to sensitize state governments, meet health secretaries. And the vision that they have is that when we have a universal health coverage, each state in India will have a tailor-made health plan depending on the disease burden of that region. So, clearly the government has a lot of work cut out.
So from what we see here, it seems like the government really needs to take some more stronger steps in order to roll out the UHC in India. Thank you, Dr. Sengupta, for joining us today.
Thank you very much.
And thank you, Vidya, for joining us today. This is it from today's edition of From the Newsroom. Stay tuned for more.